Okay, we are now recording. Yeah, welcome to our third week of these community conversations. We are so glad that you're here. We have been doing these conversations in response to the current coronavirus pandemic, and just hosting topics on different themes. I'd like to introduce you in a second after I go over kind of the structure and the instructions here to Jane Stevens, our publisher and founder of This Is Connection, and she will then introduce our speakers. So we have a chat. You can click on the chat button and you can put your comments and questions in there. There are a lot of us, so I know in advance I won't be able to get to every single person's comment and question, but we will try. And we really welcome and invite you to participate, and that's what these conversations are all about, is the community participation. So we really welcome your questions and comments there. So if you just go ahead and put those in the chat, and then when we get to a place where we can call on you, we will ask for you to unmute yourself and speak up. At the moment, I do have the ability to unmute yourself disabled, but when we get to the conversation part, then I will make it so that you can unmute yourself. So without further ado, Jane Stevens.
Thank you, Allison, and thank you all for coming. This is really wonderful. It shows the drawing power of the folks in Philadelphia and the work that Vic and his group are doing. So I just wanted to just say again why we are calling this the better normal is because it was very clear after this all started and people were saying, I want to go back to the normal, and I realized I didn't like the normal. I didn't like the normal didn't provide health care for everyone. I didn't like the normal that required many parents to work 2 or 3 jobs to support their families and hardly ever spend any time with their kids. I didn't like it that didn't provide enough family leave for parents to spend time with their newborns or ill children, or with their parents or other loved ones. I didn't like the normal that left millions of people hungry, hundreds of thousands of people homeless. I don't like the normal that does not provide equity in education, that saddles a generation with an extreme burden of college debt. And I don't like the normal that says if we have a disaster like this, that economic support isn't automatically provided immediately instead of weeks later. So that's why we're calling this a better normal, because we are aspiring to creating something that is a better environment for all of us and our families. So without further ado, I'm going to introduce Vic Comfir, who is one of the producers of CAREgivers, which is a wonderful, wonderful film. If you haven't seen it, I highly advise you to take a look at it. I think that what he did with it and Rodney did with it is just wonderful and so needed, and especially during these times. So I just, without further ado, introduce you to Vic. Vic, I know you want to say a few things. And then Vic, if you will introduce the other people from the Philadelphia ACEs Connection or ACE Task Force, and that would be great.
Well, thanks so much for inviting us and for this opportunity, particularly during this historic and very sobering time. It is really incredible what we are all living through, and the amount of suffering that is going on right now and is anticipated. It's also proving to be a time of a lot of reflection for many people, even a kind of forced retreat, shall we say. And so I think it is indeed, as Jane, you've said, an opportunity for us to create a vision of a better normal in the coming months, hopefully, and years. The area that Caregivers Film focuses on, as many of you know, is really on secondary trauma, also called compassion fatigue and vicarious trauma, each of those terms having slightly different but related meanings. And I hope if you have not seen the film that you will visit our website at caregiversfilm.com. And there's quite a bit of information there. And we also have a YouTube channel that has lots of shorts about aspects, features of the film. The film focuses on many different kinds of professional supervised care to traumatized people. And each of those individuals, whether they be child welfare workers or firefighters or therapists or hospice workers, EAP workers, many different varieties of people in our society that provide care. In addition to the little vignettes, there's also commentary in the film by people such as Sandra Bloom, Diane Wagenhals, Charles Figley, and other experts such as that who provide a context. There's probably no greater current example of secondary trauma and primary trauma that's occurring for many of our healthcare workers right now. These are our frontline caregivers, and perhaps some of you viewing today are among those healthcare workers. What they are doing is absolutely extraordinary on our behalf and on behalf of our loved ones, and they're doing it, as we know, at great risk to themselves, in many cases without the sufficient PPE equipment, even masks. I was talking with a friend of mine recently who is, in fact, a pediatric doctor, and she is so deeply concerned herself about the children, and she's also working with adult patients. Everyone's kind of jumping in, all hands on deck. But her anxiety, her risk-taking was so extraordinary. And we were in a little online group talking, and someone asked her, well, what are you doing in your free time? And she said, I'm working on my will. I don't have a will. And I thought, oh my gosh, this is really sobering. And she was quite earnest about that. She also indicated some sources to which we might make donations that could add immediate assistance. But I'd like to begin with a tribute to these healthcare workers who come in many varieties, in many contexts. And this is you might want to call this a prayer, you could call it a meditation, a reflection for our health and healing of helpers. And I wish I could attribute it. It was sent to me by a friend and did not have attribution. So I'm going to go ahead and take the liberty of sharing it, because in a way it's so universal. And it says, may the one who blessed our ancestors bless all those who put themselves at risk to care for the sick. Physicians and nurses and orderlies, patient transporters, hospital cleaning staff and security guards, technicians and home health aides, EMTs and pharmacists who travel the unfolding dangers and navigate the unfolding dangers of the world each day. To tend to those they have sworn to help, bless them in their coming home and bless them in their going out. Ease their fear, sustain them, source of all breath, healer of all beings, protect them and restore their hope, strengthen them that they may bring strength, keep them in days. So I want to dedicate this entire time to, in particular, to these people, but also recognizing that there are many, many other kinds of caregivers that are on the front lines right now on our behalf. I'd like to also let you know who is here from our Secondary Trauma Policy Committee. These are a really creative group of mostly volunteers. We have one of our terrific supporting staff persons from the Health Federation and Philadelphia ACEs Task Force, but the people who will be in conversation at the beginning of this program with me are Laura Vega. Laura is the co-chair of the committee, and she is from Children's Hospital of Pennsylvania, a social worker there, and also from Children's Hospital of Philadelphia, Kristen Kozer and Carolyn Menapace, M-A-N-A-P-A-C-E. They are all involved in various ways with the violence prevention program at Children's Hospital and are very deeply schooled and do training in trauma-informed care. We also have present today Megan Gannon, who is a social worker at Jefferson Hospital, Jefferson Medical College here in Philadelphia, and Megan Johnson, a social worker from the Philadelphia Child Advocacy Center, who works a great deal with child abuse and the child welfare system. We have with us Carolyn Smith Brown, who is our project manager and employed by the Health Federation of Philadelphia, who's doing phenomenal support work for everything we're doing. Nicole Fuller is here with us. She's the executive director of Philipposh. Philipposh is a coalition of major unions, mostly here in Philadelphia, although many of them have national and international ties. But they're a coalition of major unions that seek to promote the health and safety of workers. And they've been right at the table with us in the development of our strategy for ultimately having secondary trauma recognized as an occupational hazard that will receive recognition on a national level. And also part of our group, I don't think she was able to be here today, but a key staff person is Leslie Lieberman, one of the directors at the Health Federation. And unfortunately, Rodney Whittenberg is not feeling so well, but is not able to be here with us today. But he's been an incredible contributor to our efforts, and our film Caregivers would never have been brought out without his enormous creativity and assistance. So having said that, what I'd like to do is give you a little bit of background, but also before we get too deeply into our work as the long range aspects of our work, I want to introduce a couple of our members who are focused on doing something immediate right now during the pandemic. I think that's where our heads are at and our hearts are at. And the rest of what I have to say and what the others have to say kind of surrounds, obviously, the present situation. So I want them to speak, chat with us early on, and then we'll take a few steps back and look at the bigger picture. point on addressing this subject, and that was the creation of the film, the production of caregivers film. The long title is Portraits of Professional Caregivers, Their Passion, Their Pain. We just call it Caregivers for short. And we had three major goals at the inception of that film project. And the first was to create public awareness as well as greater professional awareness. In other words, an educational role. A second goal was to inspire agencies locally and across the country to create what we would, many different names for it, but we could call it today staff resiliency programming, so that the wellness of our caregivers is not solely dependent upon their own personal self-care program, but it is also based on their organizational engagement and how the organization hopefully is presenting and creating programs for them. And the third goal, which is what we'll be focusing on a good deal today, is the development of policy. We always wanted from the beginning to have a film that not only did these first two things, but that would have a longer range goal or objective to influence local and national policy. I think being true to the moment and the pandemic, I'd like to kind of toss the ball over to Megan Gannon and Megan Johnson, who are taking an initiative right now in their committee to set up supportive online sessions. I believe we have one coming up on April 6th and another one on April 16th. And they will be taking turns, and some of the rest of us on the committee are also planning to continue this series, geared largely for our community here, Philadelphia ACEs Task Force, but I believe that we could also post it nationally with ACEs Connection if there are some of you that would like to tune in to these sessions. They're going to begin with a kind of emphasis on mindfulness-based stress reduction, and also some additional kinds of exercises that help to ground us, to keep us focused, to bring out our wisdom and our thoughtfulness and our skills. So I'm going to toss the ball now to Megan Gannon, if you would like to catch that and say a word.
Sorry, Vic, do you mind if sorry, this is Megan Johnson. Sorry, Megan Gannon. Do you mind if I hop right ahead of you? I just have to hop off at 3:30, yes. So I apologize, and it didn't want. Yes. I apologize, Megan Gannon. And I apologize to everyone else that I am very green. There is something wrong with my webcam, and I have been unable to fix it. So I'm aware of the very bright tone that I bring to the screen.
Thank you, Megan Johnson.
But as Vic said, my name is Megan Johnson. I'm with the Support Center for Child Advocates here in Philadelphia, and I work with our Center for Excellence in Advocacy, which is our training department. And together with the Philadelphia ACEs Task Force and the Secondary Traumatic Stress Work Group, we talked about the need to have spaces to bring community together in a time like this. And so a lot of the trainings that I do with my colleagues are around secondary traumatic stress and vicarious trauma. But in doing that work, we've recognized the need for kind of grounding and mindfulness practices. So we have a session coming up on, as Vic said, April 6th, and then another one on April 16th that will focus on kind of integrating mindfulness into your work and your life during this kind of COVID-19 pandemic and beyond. So I think this idea of a new normal is like, how can we kind of bring these practices and recognition of the need for support, not only now, but carry it through with us. And so we're hoping to utilize these virtual cafes to bring people into these discussions and share with one another And so we're really excited to do that and to have the chance to talk with you today about that work. And so with that, I'll toss it to Megan. Sorry again to jump in on you like that. And thanks again for having us on this call. We hope that you'll be able to join the session next week.
Hi, thanks, Megan. Sorry, it went in and out a little bit. I'm unsure if my internet connection is working too well right now, but I'm glad to be here today with everybody and share a little bit about a session that I'm working on with two of my colleagues. I work at MATER, which is the drug treatment program at Thomas Jefferson University for women with substance use disorders. And we've incorporated mindfulness in all aspects of the drug treatment program and a program called Mindfulness Dialogue for Life. And so I'm working with the director of the MATER program, Dr. Diane Abadamarco, as well as Danny Martin, who is a mindfulness teacher. And Diane and Danny created this Mindfulness Dialogue for Life training and curriculum for our staff at MATER to help all of us counselors, clinical staff, researchers, administrative staff, all of us, to help us with our exposure to, secondary trauma, to improve our communication, being mindful with one another, and to help us all connect with, the larger picture of why are we all doing what we're doing, what called us into this line of work, and, what makes it meaningful for us. And so this session that we'll be working on after the session that Megan Johnson talked about will be, guiding everyone, introducing them a little bit to this mindfulness dialogue, giving everybody an experiential piece. So doing a mindfulness exercise with the group and doing a little bit of sharing to help everyone kind of connect to that again and be exposed to that. We ourselves are doing a new iteration of this work at MATER in response to the COVID-19 crisis. So, it's a timely piece for everyone. And I know that the group, we've talked about some other topics for possible cafes in the future, maybe things like trauma-informed yoga for staff, or non-traditional modalities that can help manage stress and exposure to trauma, things like acupuncture and things like that. So we're working on various different topics, and I'm really looking forward to being a part of the work with everybody.
So
Vic, can I jump in with
yes,
a question for
yes,
Megan?
of course.
I would like to know just a little bit more about how this is different. You mentioned that that you changed it a little bit because of the COVID-19 pandemic. Can you just say a little bit more about that?
Yeah. So in the traditional mindfulness dialogue and mindfulness work that we do at the practice, it's a lot of like general practices and things like that. In this one, Danny and Diane created this like 21-day program where it's like each day is a different theme that you can reflect on. And so what we're doing is culling some of those themes and adding new ones. So each week at our work, like actually next week, our first theme is fear. So it's all of the fear of the unknown, how we bring that into our work, how we bring it in with our clients in therapy and things like that. Another week's theme that we identified today will be self-compassion. So, one of the things with therapy is, you're constantly giving to other people. So that week's theme will be that. So what we're doing at our work is on Monday, we'll send out, we have these audio recordings that Danny and Diane will be recording. We'll send that out to staff. It's like a 15-minute audio recording. Then staff will listen to that and try and do the meditations throughout the week. And then we have a Friday Zoom. And management and supervisors are, really helping to cheerlead this with all staff. And then at the Zoom, it's optional, but staff can call in and we'll do a guided meditation for them based on that theme, and then open it up for a discussion, like how that resonated with everybody, and just have like an open dialogue.
Wonderful. Well, one of the things I'm so pleased about is that this is an example in which our committee is really planning to walk the talk. So we're not just having sort of abstract discussions about wouldn't it be nice that, and maybe in the future this and that will happen. But I think the pandemic is giving us this amazing challenge and opportunity to connect. It's so ironic that in this period of social distancing, in many ways, we're getting closer. Not just our committee, but I think this is a phenomenon that's happening all over the country. We'll come.
Yeah, I would just want to, before we move on,
Yes.
If anybody else has any questions or about what's being done differently, I think that the fact that you're starting out with fear is perfect. You know, I think that people are gripped with that. You know, if not continually, some people, but at least, you know, at 3 o'clock in the morning when you can't sleep. So I think addressing that is just wonderful. But are there other folks who have other questions about this? I'm so glad that you're doing this.
Thank you.
Thank you, Megan.
If you do, just type them in the chat and we can come back to it later as well. So go ahead, Vic. We'll see if there are any other questions later.
Hearing you right now, Jane.
Oh, I can hear you.
Okay, now, okay, good. Now you're back on. Okay, great. Well, like I said, we'll come back to this. Maybe you'll be thinking of some questions a little bit further along the way, but I'm going to backpedal a little bit now and just name briefly, very briefly, highlights of a process. It's kind of an evolutionary process that in some ways was launched in January of 2016. And as I cite these events, and as I thought about them today, I realized it's almost like counting one's blessings. It's just really quite exciting and wonderful the way this process has evolved up to the present time in our work around secondary trauma. And the launch, I would say, started in January of 2016 when we had a major screening, some 250 plus people at our local public broadcast building awareness. A second highlight that I'll point to is that the following year, February 17th of 2017, we were invited. It was our idea, but we also received a really
So Vic, your audio is going in and out and you can't hear me now either. Yoo-hoo, we can't hear you.
Are people able to hear me?
There we go. Now we can. Now we can't. There we go. Okay, go ahead.
Okay, I don't know how much you might have missed. I mentioned a film festival that occurred January of 2016. That was
yeah, we got that. Wow. But you keep going in and out, and I'm not sure what's happening with that. And you can't hear me.
Vic, do you have maybe some different headphones?
The caregivers of the city.
Vic?
And
Vic, do you have some different headphones? You keep going in and out.
Okay, let me try a little different system here. Let's see if that will help. I'm so sorry that might be happening or is happening.
We're getting the opportunity to practice patience.
We're getting to play with these technologies and see if see which one works better. Can you hear me on this one?
Yeah.
Great.
Okay. Okay.
Thanks so much.
And just a time reminder, we have about half hour left. So
okay.
we could I want to make sure we get to the crux of this policy stuff.
Okay. So to make a long story short, there was a series of these wonderful events that were sort of awareness building, and the next Caregivers Day was Caregivers and First Responders Day. And then in the fall of 2018, very much with the assistance of the Philadelphia ACEs Task Force staff, we invited a group of panelists. This was actually an invitation.
Yeah. Look up, and he's frozen now too.
An actual resolution, a call for resolution to federal OSHA to recognize secondary trauma as an occupational hazard and to develop standards that might include staff resiliency programming. So I think with that kind of quick and dirty background there, I'd like to toss the ball to Laura Vega, who can tell you a little bit about our committee, which we also call our Policy Toolkit Committee. Laura, can you share a little bit about that?
Sure. Hi, everyone. Thanks for the opportunity to be here with all of you. Just to summarize, we are part of our work with the ACEs Task Force is really to develop a compendium of centralized resources to address secondary traumatic stress, and looking regionally and internationally about what evidence supports different interventions, programming, and I think we have consensus for our group around the importance of more of a community-based organizational approach, and really trying to get individuals to understand that when we support our staff and caregivers, we really do better quality care to our children and families. And so just hoping to get a good set of resources available and centralized, and then be able to share those resources more broadly with individuals to utilize.
Can you hear me, Vic?
Yes, I can hear you.
Okay, great. So Laura's all done. So.
Okay. Let's talk a little bit about the City Council resolution. This was something that was introduced by Councilman Derrick. Hold on a second. We can't hear you. Maybe is there a...
Yeah, Nicole or does anybody else? Vic, do you think, sorry, Vic, this is Laura. Yes. Just because I think your audio keeps going in and out, it may be best to have someone else summarize kind of the next point so we save some time for discussion. Okay, very good. I want Nicole or Caroline, do you want to join and talk through some of the City Hall updates, or plans to work with city departments?
This is Nicole. Hi. I can speak to the city departments and the union side of things. So I'm Nicole Fuller, the director at Philippi, as Vic mentioned earlier. And I became involved, I think originally we participated in the hearing that was held at City Hall in December of 2018. But then I was not the executive director. But since I came on as a director, I'm basically there to navigate through the union's politics and processes, and try to get them involved with the whole policy and program as a whole. You know, we've talked about how to navigate getting resources, trainings, information to union members by engaging union leadership. And because a lot of the workers that we're talking about are union members. And so, you know, Philadelphia is a union town, so that feat in and of itself can be kind of overwhelming. But we wanted to start with some of the city departments, specifically maybe pick a couple of departments, and then try to engage the leadership, you know. And I tried to tell the committee or the group that won't always be easy or positive, but that's basically what I'm here to do, and that's my job, is to help them navigate through the madness.
And Nicole, can I ask a quick question? What was the reception of this in the union, and then what is your first reception, say, from some of the city department heads you've been talking with?
Well, the first reaction to the union was basically with our board, because the majority of our board members are union members, and it was a positive reaction. They thought it was useful and that we should move forward with it. As far as the city departments, I know one union leader she's very open to it, but since all of the stuff has been happening with the pandemic and that type of thing, I haven't been able to really touch base with her since then. So I think for the most part, we'll probably have positive feedback. That's just my personal thought, though.
That's terrific.
Mm-hmm.
I wonder, Carolyn, if you're able to hear me, would you like to add anything at this point about the role of the Philadelphia ACEs Task Force and the various committees?
Hello, can you hear me?
Yes.
Terrific. Yes. Hi, everybody.
Hi, Carolyn.
So I'll just kind of jump into the middle as opposed to trying to give some history. Some of the things that Vic described had to do with what leads up to now. Like, how did we end up trying to work on secondary traumatic stress with the city departments as a whole? And there's a legislative process that I'd be happy to talk with people about, perhaps even another time. Any of you who are trying to make change through policy, we definitely have some lessons to share with you about that. So some of what Nicole described is where we are right now. And we had followed up a city council resolution with a set of actions that we wanted to take to engage people more deeply and give them the opportunity to talk about what are they doing. So our pathway has been not to tell people you're not doing enough, but to invite people to recognize the things that they are doing and to share those with each other so they actually can strengthen their work and reaffirm it through that sharing. So we were actually midstream in reaching out to city departments right now, several of whom actually testified at the hearing that was held at City Council. And with the pandemic, it was kind of like, wait, you know, our point is to reduce stress. It's not to increase stress. And, you know, as the title of this shares, it's like there's a new normal. Right now, we're in the midst of everybody's brain being so stressed. It's hard to do business as usual. And that's actually a lot of what led to us doing this series, which we're kicking off this next week. It's like, what can we do for people? So Laura Vega, you know, talked about this when she was doing a piece on it. How can we help each other right now? You know, doing policy is great. Sometimes we just need information. Sometimes we just need time with each other to say, how can we bring this into our own lives?
Can we also hear from Betty Lee Davis very briefly about just maybe 2 or 3 of the elements of the resolution itself? Is that possible?
Yes. Let's see. I think the primary thing about the resolution is that, I won't say the primary, the resolution was designed to serve as a letter of petition to OSHA, so that it, and that resolution, the call upon City Council came out of the hearings in December of 2018 as a result of what I had come to see as the committee was preparing for those hearings, which was it actually falls upon OSHA to create a standard, and the way that came to me, or to protect the workers from workplace hazards is I felt overwhelmed as the committee was looking at ways to put something in place for the city. And I thought, as large a place as Philadelphia is and as many departments, this feels overwhelming. And then the light went off. I thought, wow, that's up to OSHA. So it fell to me then to look into that. And what I learned is that OSHA, no one had brought this to their attention. And they said they thought there was a place it could fit. And the person I spoke with told me the step to take, which was to petition them with a letter. So that basically was the call that I took to City Council, and that's what they did this past December. And in the resolution, what it brings forth, and I can read you the title of it, calling upon the Occupational Safety and Health Administration to recognize secondary traumatic stress as a workplace hazard, recommend steps to address mental health injury as a psychological hazard in the workplace as they do with physical injury, and create a standard for secondary traumatic stress. And so the resolution begins with citing the law, the Act of 1970, the Occupational Safety and Health Act. So this is actually a law. It's it's something that exists to protect workers. So and to ensure that they have safe and healthful working conditions, which we all know who are aware of secondary traumatic stress, and certainly those who have seen the Caregivers film are quite aware that it's not safe and healthy for all people. So the resolution acknowledges the work of the Philadelphia ACEs Task Force and its Philadelphia or Take Care Philly initiative. It also then acknowledges the testimonies that had been brought forward during the hearing by City of Philadelphia workers who shared the effects on City of Philadelphia workers who've been exposed to the trauma of others. It also recognized resiliency programs that are already in place in Philadelphia, and then it acknowledges what it is that OSHA can do. And basically, without going into too much of the detail, it will it will do research to look into a condition that has not been identified, that's considered has been unrecognized. It will then do trainings of personnel in the workplace who can then identify this and put into place steps to protect workers. And what I learned through talking with the person at OSHA is that there are two things that can happen. One is that once the petition is submitted, if they find that it has merit, then they will create a standard. And I was told that it takes 7 years to do that. Well, that's a pretty long time from now. So they said immediately they will create a website. So that's
so Betty Lee, if I could,
yes.
if I could jump in, and I just wanted to say that we can post this resolution and people will be able therefore to get into it. I know in the interest of time, there are probably questions. So I think we ought to open up the floor to our listeners to see what questions and contributions they have. But if we could post the rest of this, people would be able to get into it. Is that all right?
Yeah, so
I appreciate it.
I'm just going to go ahead and allow participants now to unmute yourselves. So just watch out for that. To all of you, just make sure you're on mute if you are not speaking, just to reduce background noise. I know in my neighborhood right now, there's a lot of construction happening, even though there's supposed to be a moratorium on construction right now. So let's see, we have a comment from Marshall. So if you want to go ahead and unmute yourself and ask your comment, we welcome you to do that. Okay. Marshall, I'll just go ahead and read Marshall's comment. The information from Megan was very interesting about staff support, weekly themed recordings and exercises, for example, fear and self-compassion. Can more about this information be shared via ACES Connection? Jane?
Absolutely, and I think Carolyn put a response on there saying that she'll share the invitation on ACES Connection to the event when it's scheduled. And I think there was another similar question to that from Mary Grumman.
Mary, do you want to unmute yourself? There you are.
Yeah, my comment was about getting more structure and getting kind of a complete list of the topics that we talked about self-compassion, fear. You know, if some groups are already doing this work, could we post that? Because I'm thinking that's exactly what we need to do in our area. But I don't want to reinvent the wheel.
So Carolyn or Megan, I guess it'd be, or Laura would be the ones. No, Megan. I'll get it straight. Megan, could you answer that question?
Yeah. So maybe when Carolyn shares the invitation, that's one way to connect.
Jump in if you.
Sorry, the virtual cafe will give you an idea of what that training is like. And then I'm happy to share my email too, to connect you to some of those resources.
And what other topics are you going to be covering in the in those? Have you decided on all of them for those 13 weeks?
I don't believe we have. We have ideas for all of them. I think that's what we're organizing right now.
Okay.
So we have a comment here from Roger Sherman. And you're welcome to just share your comment with all of us if you are around. You're welcome to unmute yourself. Okay, I will move on to Caroline Ann. And you are welcome to unmute yourself and share. I see you.
There we go. Thank you. I was trying to do it myself. Yeah, I just wanted to share another intervention that we are using in our program at CHOP. It's called the Stressless Initiative, and it's a group supervision model to address secondary traumatic stress. So I did put a link. There's a one-page fact sheet on our website, so you can check out a little bit more if you're interested in learning. And something that's very timely is that we just facilitated the group with our team last week, and we were successfully able to do that through Zoom. So definitely something that can be implemented right away for agencies and organizations who are interested. It's definitely feasible using technology.
We might also want to say that Laura Vega is the primary developer of this program, and I'm wondering, Laura, if you and Caroline might want to post on ACES Connection an article posting about what Stressless is about and sort of your basic concepts, and maybe where people can get more information. Is that okay?
Vic, I think this is a great reminder for me, because during these conversations, I like to invite each and every one of you to know that you can post on ACES Connection. So we are a network of 40,000 members all over the world, which is just so amazing. And anyone who is a member can post to our website. So the way that you do that is you go to acesconnection.com, and you just have to make sure that you're a member. And so you can just join if you're not a member yet. And then you want to make sure that you're signed in, that you're logged into our website. And then once you're logged in, you just click the post button in the upper right-hand corner, And it will give you a couple of different options of different types of posts you can make, such as a blog or a calendar event, or we have something called Ask the Community if you want to ask our community a question and get some different feedback from people. So we invite each and every one of you to do that. One other option is to post your post within a sub-community. So we have the greater community of all 40,000 members, and that's the main website that you see when you go to acesconnection.com. And then we have smaller communities, and many of you are members or community managers for those communities, and we love that. Thank you so much. And then some of you are not yet members. Maybe you didn't even know you could join. And so I would like to invite you to join the community. You just go to our main website, acesconnection.com, and click the communities button on the upper left-hand side of the screen, and you will see a list of all of the communities. Many of them are geographically based, like our Philadelphia community, and then some of them are interest-based, such as ACEs in Education. So Vic, that's a great idea. We would love for you all to, if you have a great program or resource, please do come on over to our website and make a post about that. That's what we want. So, okay, Jane, do you want to do maybe one or two more comments?
Yeah, so Amy had a really good question. So do you want to unmute?
Amy. Let me see.
Amy Shield-Jones, I hope I'm saying that correctly.
Yeah, I see that she's still on the call, and I have offered to let her unmute.
Hi, everyone. Yes, I'm still here. Thank you for the opportunity to ask my question. Hello, everyone. I think my question was related to the policy work. As I wrote it, I was considering, given the status of the impact on state and local budgets related to the pandemic, what do you anticipate as the potential impact on the policy work? Are you predicting that it may be set aside? Are you predicting that perhaps it will be accelerated because of a universality of recognition of the experience? Or are you considering a need to sort of crosswalk the advocacy strategy that you laid out before with the current context to help state and local government understand the need within the current context?
Carolyn Smith-Brown, I wonder if you could respond to that.
Can you unmute yourself? Or
I do have it to where participants can unmute them. Oh, maybe I didn't have it quite right. There we go. So you should be able to unmute yourself.
Thank you.
Okay.
So absolutely, we are, I think your point about crosswalking, we're trying to figure out what a crosswalk looks like. I don't know if people on this call are also involved in CTIP, the Campaign for Trauma-Informed Policy and Practice, and they do national calls about once a month. So there was some work that was gearing up in there around getting folks to get their legislators involved in the Trauma-Informed Caucus. And on our last call, it was kind of like, whoa, okay, you know what? Right now, everybody's mind is on the pandemic. So let's just take a pause on that particular set of work and let's focus in on how we can make the best impact now. There are so many opportunities for trauma-informed practice to build into the new normal that it seems like this is a time to try to figure out for yourselves, like, what is it that I want to do and where can I help? And I think of one panel that the Philadelphia ACE Task Force sponsored, which included business people on it. And it was about bringing things to scale. And how do you bring like your great ideas into this broader venue? And one of the people who was from business spoke and said, you know, policy is one way, legislation is one way to make change, but really if you go in and actually use changes and share with businesses how they can make a difference, you can make an impact sometimes faster than you can with policy and legislation. So this seems like one of those opportunities to try to do that without leaving policy behind, because ultimately policy sometimes is what sustains changes that we want to see.
Jane, do you have any responses, or should we wrap up, or is there another comment you wanted to take? We did get a comment from Whitney. Whitney, I'm going to send you an email about making a post on our website to put those up. I think that would be great.
And I see that Nicole answered Lucy's question, so that's good. I'm encouraged to see. I like that crosswalk idea that you all were talking about. That really makes sense, because you're pushing this at any place that you can push, and I think that long term the policy will be important, so that it stays when you have people who come in who think that maybe we don't really need this, and we all know that we absolutely positively do. So yeah, that's all I have.
How do I make a comment? Can you hear me?
Yes, go ahead.
Yes.
Yes.
I just wanted to say, Jane, in response to the long-term policy possibility with OSHA, I was mentioning the website, and actually there's the workplace violence website is kind of a model that would correspond to this. And if they decide that this has merit and they accept the petition, then they will they'll take what we send them, but then that's what they do. They research this and they put it up. So that would be something that workplaces could look at immediately, that those who are wanting to inform the city of Philadelphia or elsewhere, they can also refer them to that website as a resource, and that is a way to help things move a bit quicker.
Well, I think it's remarkable that you all are doing this, have done this work and laid this groundwork for this, because I think it's going to make a difference for everybody. And I also think that we don't really know the impact that it's going to have, but we know that previous policies that OSHA has taken up do make a difference. And so, kudos to you all for doing this.
I'll give, if I may, just a teeny quick example in a form of a tribute. Vic brought that to my mind, to the son of a high school friend. My friend died at Christmas, and her son is a very dedicated paramedic who travels around the country and the world going to all kinds of things. And when I made him aware of this, he was very grateful. And he gave me an example of a situation when I mentioned OSHA and, wondering about how it might be put into play in an everyday kind of circumstance. And he said that they had, if I get the details straight, an ambulance or one of their vehicles that had a fire or had something go wrong with it. And the person over him was saying they had to use it. And they said, no, it's dangerous. And they called OSHA, and they showed up immediately on the spot and said, no, they could not use it. So that's a bit of a testimony from a worker on the front lines about how quickly OSHA responded to that request.
Terrific. Yeah.
Paul Bishop is his name.
Well, thank you for letting us share all this, and very grateful that there's so much interest, and we really hope that other communities, and probably you are doing some similar things, and there may be a point in which your local Philadelphia ACEs task force can send a friendly letter to OSHA once everything gets registered there. That will be, I guess, after the pandemic settles down a little bit, but having letters of support going to OSHA showing interest. So it's not just a Philadelphia request, but it's coming from hopefully many other parts of the country.
Thank you, Vic. And could, if Florina is still on, could you tell everybody what you just put in the chat before we go?
Sure. Yesterday I read that you're not working from home, you're working at home during a crisis, or you're at home during a crisis trying to work. I just think that's important to remember, right? We're all just doing our best. And I think meetings like this are very helpful, because we're not only sharing ideas and getting lots of information, but it's just nice to see faces, you know, when we're all kind of stuck at home.
I agree. Thank you. Allison?
Yeah, we are going to wrap up. I just want to thank you all so much for joining us and taking time out of your day to participate. You know, we are a community, and you all are members of our community and create this community. You're co-creating it with us. And we are so grateful for your presence, both here today in this conversation, and continually over on our website, which is our community at acesconnection.com. And we hope that you will continue these conversations in our communities, and that you will join us again. Jane, can you tell everyone a little bit about what's happening tomorrow?
So tomorrow, a couple of our staff, Karen Clemmer and Laura Ujeski, are going to be looking at what's happening with pediatricians as well as in maternal mental health and maternal health. So I think they're going to put on a very interesting conversation, but it is a conversation, you know, as much as we can. So please join in for that. And we have also three sessions scheduled for next week, and I'll put that in a blog post. But thank you so much, everybody. We value you and everything you're doing.
Thank you.
Thank you, Vic and Megan and Carolyn and Laura and Betty Lee and Nicole for speaking today. Thank you, Jane, for facilitating. And we hope to see you all right back in the same room tomorrow, same time.
Bye-bye.
Bye. Stay safe.
Bye.
Bye-bye.